Hi everyone, welcome to another exciting and informative episode on health checks with Dr. Memstic. On our last episode, we talked about cervical cancer, where we described what it was and discussed the commonest cause of cervical cancer, which is the human papilloma virus. And to continue in this episode, we would be talking about the risk factors, the things you can do, and the things that put you at risk, increased likelihood of coming down with cervical cancer. And then we'll talk about the signs and the symptoms, what you should look out for, or if you have a family member or a sister, someone who has complained of such symptoms. This will give you an idea of what the person may be dealing with, and your responsibility is to ensure that the person gets to the hospital and gets screened, and cervical cancer is ruled out. We'll also be talking about the preventive measures and the screening that can be carried out to diagnose cervical cancer, and briefly on the treatment options. So the risk factors for cervical cancer, as with every cancer, we have the modifiable and non-modifiable risk factor. And the non-modifiable risk factor, the number one of it, that's non-modifiable, I mean things you cannot do, you cannot change, you have no control over. And this is your gender. Being female puts you at risk of having cervical cancer, because it is we, the women, who have a uterus, we are the ones who have a cervix. The male gender do not have a uterus, neither do they have a cervix. So being female puts us at risk of developing cervical cancer. Another non-modifiable risk factor is a family history. If you have a family history, you've had a mother, a sister, or even a daughter who has had cervical cancer, it places you more at risk of developing cervical cancer. So another risk factor, the modifiable, the ones you have control over. The number one risk factor is the age at which sexual activity commenced. An early age of sexual exposure places women and girls at increased risk of coming down with human papilloma virus. And if your body system is such that the virus cannot clear on its own, it can cause changes in your cervical cells, and then later it could become cancerous. So early age of sexual exposure. So it's advised that you delay sexual activity we should encourage our young girls not to be sexually active at an early age. Another risk factor is having multiple sexual partners. As a woman, if you have multiple sexual partners, it puts you at risk of picking up HPV infection. And also having a male partner, you may say, I don't have multiple sexual partner, but you have a partner who has multiple sexual partner. You are also at risk of picking up HPV that could eventually lead to cancer of the cervix. Another risk factor for cervical cancer is cigarette smoking. If you're a lady and you engage in smoking cigarettes, there are certain substances in these cigarettes that can affect and cause cellular changes in your cervix that could result to cervical cancer later in life. And women who have low immunity, maybe due to HIV/AIDS or diabetes mellitus or any condition, or maybe you're on some drugs that are suppressing your immune system, it puts you at an increased risk of picking up cervical cancer. And then if you have a history of, or you have been dealing with sexually transmitted infections, repeated sexually transmitted infections, you are at risk of picking up HPV infection, which could later, if the body doesn't clear it, lead to cervical cancer. What are the signs and the symptoms of cervical cancer? It's important to note, as with every other cancer, at the early stage of it, you may not have signs and symptoms. You may just be going about your normal activity. But as the disease progresses, there are certain complaints, there are certain symptoms that the person may experience, and this could be a pointer to cervical cancer. What are the symptoms? Number one, unusual vaginal bleeding. You notice that the pattern for instance, if you're still a woman that is, menstruating, you're experiencing in between periods, you're experiencing bleeding in between your cycle, intermenstrual bleeding. That could be a pointer to the fact that you may be having cervical cancer. It's not up to 30 days or 28 days and you're bleeding in between your cycle. Don't ignore that symptom. Seek help. Another one is what we call postcoital bleeding. Postcoital bleeding just means bleeding after sexual intercourse. If you notice that after you've met with your husband or your partner, you start spotting or bleeding, please, that is a pointer to a fact that you may be having cervical cancer and you should not ignore it. You should get screened immediately. Another abnormal pattern of bleeding is the postmenopausal bleeding. A woman who has clocked menopause, has stopped seeing her menstrual flow, and then all of a sudden you start experiencing menses again. We know there are some myths and misconceptions where women say, oh, God has visited them again, they are fruitful again, it means they are going to have a child after you have clocked menopause. That's not that's a misinformation. If you start experiencing menstruation again or start bleeding after years of cessation of your menses, please don't ignore that symptom. Don't overlook it. Get to the health facility, see a doctor, and get yourself screened. Another symptom of cervical cancer is abnormal, foul-smelling vaginal discharge. You're producing vaginal discharge and it is foul-smelling. Sometimes it's mixed with blood. My sisters, my mothers, my aunties, please don't ignore that symptom. Get yourself screened. And if you also notice that you have pain during intercourse, sexual intercourse shouldn't be painful, it should be pleasurable. But if for some reasons you're having pains, please don't ignore it. Get to the facility, health facility, and look for a medical doctor. Another symptom could be persistent waist pain. At this point, maybe the cancer has started spreading and it has affected the bones of the back and you're now having waist pain. And then you notice that you're becoming anemic, as in you're pale. You've lost a lot of blood because of these abnormal bleeding patterns, and you start becoming pale. Anemia has set in. Blood shortage. Don't keep quiet. You have to get yourself investigated for the cause of the anemia. Some people may have weight loss. By the time weight loss is setting in, it has spread, and you may experience diarrhea, frequent passage of watery stool. At this point, maybe the cancer has progressed to affect your rectum, control urine, urinary incontinence. It means that maybe it has spread to your bladder. So these are some of the signs and the symptoms you should look out for. Or if you have anyone complaining of this: pelvic pain, pain in your lower abdomen that is persistent, pain during sexual intercourse, abnormal bleeding, bleeding after you've had sex, bleeding in between your period. It's not up to 28 days, it's not up to 30 days, and you're bleeding in between. Please don't ignore that symptom. And then you have a woman who is menopausal, you have clocked menopause, and all of a sudden you started bleeding. And then you have this copious, plenty, foul smelling vaginal discharge. Please don't keep quiet. Go to the right source. What is the right source? The hospital. Look for a doctor and get screened. So those are the symptoms of cervical cancer. But what is the good news in all that I have said? Cervical cancer can be easily prevented and can be easily treated, as with several other cancers, if it is picked early. This is one cancer that you can effectively treat and prevent. So that takes me to the prevention. In 2023, the Nigerian government came out with vaccine, what we call the HPV vaccine, human papilloma virus vaccine. This vaccine was to be given, or is given, to young girls from the ages of 9 to 14 years. Why 9 to 14 years? We want to ensure that before these girls become sexually active, they receive this vaccine. A dose of this vaccine would prevent you from coming down with human papilloma virus. And if you don't have human papilloma virus in you, HPV virus, you're not going to develop cervical cancer later in life. So that vaccine is available, and it was given out, rolled out in the schools, given to girls, young girls. If your daughter didn't get HPV vaccine, please find a way and ensure that your daughter receives at least a dose of this HPV vaccine. Also, in some climes, because of resource constraints, financial constraints, we're not able to give the boy child. The boy child should receive a dose at least of HPV vaccine. Remember, in the last episode, I said that even boys can be infected with HPV, because HPV is sexually transmitted, and HPV is the commonest cause of penile, that is cancer of the penis, or even cancer, throat cancer, cancer of the rectum. So your boy child should also receive this vaccine. Previously, this vaccine was not part of our immunization, national program on immunization. It wasn't part of our vaccines, but now it's available. And if you insist on giving it to your boy child, you could go to the pharmacy and talk with the pharmaceutical companies. They have a way of sourcing this vaccine for you. It's important we protect our children. We protect them early. That's why I said cervical cancer can be prevented. Look for this vaccine. And after 14, some people can still take it, but then when you become sexually active, the chances of this vaccine protecting you against cervical cancer reduces. It's not as effective as that young girl that has not yet been sexually exposed. Then for the women who are already sexually exposed, the married women, you've had sexual, you've had children and all that, there is an effective screening, a secondary preventive measure, that is pap smear. Pap smear is a test that is done to check for abnormal cells around your cervix. If you've had HPV infection and the cells in your cervix are showing some changes, that test can help pick it up before it now progresses to full-blown cervical cancer. You see why I said it's easy to treat and it's easily preventable? Because with a pap smear, those changes are picked. And in some cases, as you see the abnormal cell changes, we can treat it immediately, and then that is gone. And then based on the level of the cellular changes in your cervix, we offer treatment measures to you. And in extreme cases, you can take off the womb, complete removal of the womb, and then you're free from the risk of developing cervical cancer. That is why we preach screening. Every woman from the age of 21, from 21, you should have had at least a pap smear done. Now, even if you didn't do it in your 20s, now that you are at whatever age you are, please go to the health facility and have a pap smear done. For we in Akwa Ibom State, thank God for the Medical Women Association of Nigeria Akwa Ibom State branch, we carry out routine screening for cervical cancer once in a month. Every third Tuesday of the month, the Medical Women's Secretariat on Atiku, just before the flyover. That is where you go, and you will have doctors attend to you. And we screen not just for cervical cancer, even for breast cancer, because that's the #1 cancer, commonest cancer in women in Nigeria. So you go there, take yourself there, just before the flyover at Atiku, to your right, where you have the Pilgrim Board, you have the Medical Women's Secretariat there. Every third Tuesday of the month, you will get yourself screened for cervical cancer. Like I always say, ignorance is not bliss. Even for the HPV, in areas that you have the resources, you can do the HPV tests. With that, you know your risk level, and then together we can fight cervical cancer. As with every cancer, early detection is key, and this is one cancer that can be completely treated if you follow the measures. The #1 thing is to ensure that, as a recap, the #1 thing is to ensure that our young girls between the ages of 9 to 14 years receive at least 1 dose of human papilloma virus vaccine. HPV vaccine is important. That is what we can give to our young girls as a measure of protecting them from developing cervical cancer later in life. And as for the women between 21 to 65 years, you should have pap smear done. And if you've screened once, if you had a normal result, you can screen again in 3 years' time. If you had an abnormal result, you should screen yearly so that you are being monitored. And then when it's time to act, we can take actions offer treatment measures, be it surgery, be it radiotherapy or chemotherapy. So the problem with cancer is the late detection. Ignorance, I say again, is not bliss. That is why Health Checks with Dr. Memstic brings to you health information, empowers you with the knowledge and the information you need, what you need to do to look out and then ensure you stay healthy. Cancer, cervical cancer, is killing women yearly. Don't sit down and wait until it becomes full-blown cancer. If you've had any of these symptoms, please go and get screened. Whether you have symptoms or not, so long as you are sexually active as a woman, you should have pap smear done. That is the information for you today. Inform a friend, inform your mother, inform your sisters, inform your daughters. Let us join hands together and ensure that we eliminate cervical cancer as a public health problem in Nigeria and in the world globally. Thank you for listening. I am open to comments and questions. Please like, share, and hit the subscribe button, and stay tuned and connected to Health Checks with Dr. Memstic. Thank you.